I'm Mackenzie Mulkey. I'm going to be doing the pediatric med administration today, and we're going to be doing the oral administration. We are going to do our general principles and safety practices first, and whenever we walk in the room, we're going to look at the relationship. You want to make sure your relationship is good with the baby or the infant or the child and the parent or the guardian. We want to look and make sure the baby's in a safe environment. We want to possibly educate the guardian on the medication that we're going to be giving, the side effects, the adverse effects, what things they probably need to look at if the baby might get a fever afterwards. But first, we're going to do the oral administration. But first, I'm going to show you the IM and the IV sites. Alright, so we have our deltoid, and it will be 2 fingers below the acromion process. And then we're going to do our vastus lateralis. We're going to find our greater trochanter and our patella, and it'll be the inner third, about right there. And then we are going to do our ventral gluteal, and we're going to put our hand on the greater trochanter. Our pointer finger is going to be at the anterior part of the iliac crest, and then our index finger is going to be posterior to the iliac crest. Those are our IM injections. And then we're going to do our IV sites. And we have, up here we have our basilic, our cephalic. On the inside of the arm, we have our median, and at the upper part of our arm, we have our median cubital. Then we have our frontal, we have our temporal, our auricle, and then on the inside of the leg and the foot, we have the saphenous, and then we have the median marginal. And before we do our oral administration, we're going to do our 3 checks. We are going to go, and our first check will include going and get the medication out of the drawer, comparing that to the patient's chart and the order. And then our second check will include the 6 rights: patient, time, route, dose, documentation, and medication. And then we're going to look at the expiration date on the medication. We're going to look for the allergies of the patient to make sure that there's no contraindication there. And we're going to do any calculations if needed. If the medication goes by kilograms, we want to make sure that we transfer the patient's weight into kilograms. And then our third and final check will involve going to the patient's room and making sure we ID our patient, making sure that our patient is the person we're going to give our medication to. And then we'll give them the medication. We're going to sit down, and this baby today we are going to have to restrain. And if you needed to, you would swaddle the baby to assist in that. But we won't need any swaddling today. We're just going to hold the baby's arms down. We're going to get however much medication we need, and we're going to put it on the inside of the cheek. And then we may have to assist the infant in possibly stroking the cheek or underneath the chin. And then we would monitor them afterwards to see if they had any of the side effects we mentioned. And then we would monitor them and tell their parent or their guardian what to possibly look for. And then the one other thing we're going to do today, we're going to do ear drops. We're just going to slightly turn the infant's head, pull the ear down and back, and you will insert the few drops there. And then we are going to swaddle this infant back up and give them back to their guardian and ask them if they have any questions and document. Thank you.